1 year since we saw the first cases of COVID-19 in Massachusetts, and all this week we're taking a deeper dive into what we have learned about a mysterious and evolving virus. Today, why some people get so sick while others have no symptoms at all. Here's a look at hospitalizations since the pandemic began. You can see we peaked on April 21st with almost 4,000 people hospitalized, and then again on January 4th when we had more than 2,400 people in the hospital. The CDC released a list of pre-existing conditions that put people at higher risk. Cancer, heart conditions, obesity, smoking, and type 2 diabetes are just some of them. Yesterday, I spoke with Dr. Mallika Marshall about why people experience this virus so differently. Let's bring in Dr. Mallika Marshall now. Doctor, the big question, why is it that some people who are young and healthy actually get sick and die from COVID-19?
Yeah, I mean, we don't really know. We know that children and young adults are much less likely to get seriously ill from COVID-19, but some do, some die, and we're not exactly sure why. As you can see here, over the last 2 weeks in Massachusetts, most of the new COVID infections were in people ages 0 to 19. Most of the deaths were in people over the age of 80. And we know that the risk of severe COVID-19 does increase with age, but it's a good reminder to middle-aged folks out there that you also are at higher risk of getting very sick from COVID-19 compared to children and young adults.
Doctor, we have heard of people getting infected twice with the coronavirus, but how often are we seeing this?
It's rare, but it does happen. There was a recent study out of the UK that suggested that people who have been infected with the coronavirus might be protected from getting infected again for up to 5 months. But reinfections do occur, and with these emerging variants out of the UK and Brazil and South Africa, the problem might actually get worse. Although the thought is if you've had coronavirus before and you do get reinfected, you're much more likely to have milder symptoms than you did the first time around.
So this is interesting, and Congressman Steve Lynch was in this category. We are hearing reports of people who test positive for the coronavirus even after they're vaccinated. Is this cause for concern?
Well, there are probably a number of factors that might be at play. First of all, there are some people who are already infected with the coronavirus when they go to get their vaccine, and then they get tested and it's positive and they go, oh, but I already had the vaccine. You were infected already. The other thing is it takes time to build immunity, so it may take a couple of weeks after you get that second dose of the vaccine for you to reach full protection against the coronavirus. Also, we know that the vaccines are very good at preventing severe disease, but we don't know if they also protect you from getting infected, not developing symptoms, but being able to pass the virus on to other people. And finally, there are these new variants that are emerging, and we're not exactly sure how well the vaccines that are currently available are at combating those new variants. So there are some other things to consider when someone turns positive, even though they've already had the vaccine.
Still so many questions with this vaccine, even a year later. Dr. Mallika Marshall, thank you. And we're so lucky to be able to ask our questions of the good doctor all week long. Dr. Mallika is going to be looking into what we have learned about the virus. And tomorrow we're going to look at the treatments that are working best for the sickest patients. Thursday, the lasting effects of COVID-19. And Friday, what's next?